This video is intended as a quick guide to randomizing patients on OpenClinica for the SepTiC trial. Please refer to the SepTiC randomization guidelines for a full detailed explanation on randomizing patients into the trial. We advise site teams to use Google Chrome as a browser where possible. Every time you log in to the OpenClinica database, you will need to use the Google Authenticator app on your mobile device. Watch the video on using multi-factor authentication for more information on how to set this up. To log in, enter your OpenClinica username and password. You will then be asked to enter the 6-digit code from the Google Authenticator app on your mobile device. Navigate to the home screen and click Add Participant. The participant ID will be automatically generated. Click Add. Forms on the database are organized into visits which reflect the different time points of the study. To add a visit, click Add New and select the visit from the drop-down list. Randomizing patients onto trials 1 and 2, diagnostic and fluid. Screening must be completed prior to randomization. This is to confirm eligibility of the patient. The system will not allow you to randomize before completing screening. To add the screening and admission visit, click Add New. From the drop-down list, you will see Screening, Diagnostic and Fluid. Select the visit and click Add Visit. Please note multiple visits can be added at the same time. Complete all 3 forms for the screening visit. Date of visit should be today's date of randomization. Then complete both forms and mark as complete. You are now ready to randomize the patient once the screening visit is complete. To randomize patients onto Trial 1 diagnostic, you will need to add the randomization visit and complete the forms in the order below. Complete the randomization confirmation first. The assignment will be on this form. The randomization confirmation form needs to be completed in order to randomize patients. Complete the questions and confirm patient eligibility. The grayed out questions are from previously completed forms. You will then need to enter the date of randomization. This should be today's date. Click Randomize and then mark the form as completed. Allocation is in a separate form called Randomization Assignment. This form is read-only, which means no data will be entered. The allocation will appear under treatment. In this example, the patient has been randomized to standard care. There is also an option to print this page using the printer icon in the top right-hand corner. Once you've noted the allocation, you can mark the form as completed. To randomize patients into the fluid trial, there should be 2 forms to complete. Complete the randomization confirmation first. The assignment will then appear on this form. Complete the details on the fluid randomization confirmation page. Confirm patient eligibility and enter the date of randomization. This should be today's date. Click Randomize and mark the form as complete. The allocation will be on the assignment form. It may take a minute or so to appear on the form. In this example, the patient has been randomized to standard care. Randomizing patients onto Trial 3 GMCSF. To randomize patients to the GMCSF trial, the following events and forms must be complete: screening, diagnostic, and fluid. This must be completed even if the patient was not randomized to the diagnostic and fluid interventions. The screening visit must be completed before randomizing. Add the screening GMCSF visit. Complete the forms in the order shown below. Date of visit should be today's date, date of randomization, then complete eligibility form. To randomize patients into the GMCSF arm, you will need to add and complete the Randomization 3 visit. The first few questions are grayed out as they are read-only and for your information. Once you have confirmed that the patient is eligible, you will be asked to enter the date of randomization. Click Randomize and mark the form as complete before closing. Click on the Randomization Assignment form to view the treatment allocation. This form is read-only. The treatment allocation will be the kit number that the patient has been assigned to. You can print this page for your reference using the printer icon. Once you have made a note of the allocation, mark the form as complete and close. An important part of the randomization process is allowing time for the system to sync to show the correct treatment allocation. In this example, the randomization confirmation has been completed, but we are waiting for the system to sync properly before viewing the allocation. Once the randomization assignment form changes to orange and shows the system has updated it, we can open the form. This video is in real time, so it only takes seconds. Once the allocation is viewed, you can click Complete to close the form. This example shows what will happen if we try to open the randomization allocation immediately after completing the randomization confirmation form. You can see the treatment allocation is blank as the system has not synced correctly. To fix this, you should close the form and not click Complete, as this could lock the form. After closing, wait a moment before reopening and you can see the system has had a chance to sync. If you reopen the form in edit mode, you can see the allocation. You can then mark the form as complete. After completing the confirmation page, wait for the system to show the assignment form has updated. Then open the form to view the assignment. If the assignment is blank, close the form, but do not click Complete and wait a moment before reopening in edit mode. OpenClinica have informed us if this does not work, do not try again. Call a member of the SepTiC trial team to guide you through clearing the forms and randomizing again. Contact the SepTiC trial team if you have any issues. SepTic@imperial.ac.uk